What is COVID-19? COVID-19, or the coronavirus disease 2019, is a respiratory disease caused by the virus Severe Acute Respiratory Syndrome 2, or SARS-CoV-2. When the virus enters the body, it enters a healthy cell and uses that cell to multiply. Then, it will travel down and latch onto the branches of the respiratory tract until it reaches the lungs. This causes the airways to swell, causing respiratory complications. This may lead to a critical condition and increase the probability of death for certain vulnerable individuals. The first case was traced back in late 2019. At first, the virus spread from person to person. However, it began to spread at an alarming rate within the community and eventually spread from one country to another. Governments have then issued and ordered quarantine measures in their respective populations so that their health sectors and departments can effectively treat those who are already infected and prevent the further spread of the virus. What are the symptoms of COVID-19? Symptoms of COVID-19 are coughing, fever, tiredness, or difficulty in breathing. They may appear after 2 to 14 days from exposure, which is why quarantine measures are necessary. Based on current developments, those who are most susceptible are people aged 65 and older, those with health conditions such as chronic lung disease, moderate to severe asthma, serious heart conditions, severe obesity, chronic kidney disease undergoing dialysis, liver disease, and those who are immunocompromised. How contagious is the virus that causes COVID-19? SARS-CoV-2 is very contagious. Although its symptoms and transmission are similar to the flu, a significant number of the world's population is already immune, either through vaccine or a previous exposure to a strain of flu. Its incubation period, or number of days before symptoms manifest, is short, which is why it can be treated as soon as symptoms show. However, SARS-CoV-2 is a new virus that only began to affect the human population in 2019. The vaccine is still in development, and its incubation period is significantly longer compared to the flu. A person infected may not realize that they are already infected, while continuing to go about their normal routine, and without knowing that they are infecting others as well. What can we do to protect ourselves from COVID-19? The precautions we can take are simple yet effective in preventing the spread of the virus. Leading health experts advise everyone to practice frequent hand washing. Make sure to apply soap and rub the hands for not less than 20 seconds under running water. Use alcohol-based sanitizer when soap and water are unavailable at the moment. Stay at home. Understandably, many of us still need to go out to be able to get some of our basic necessities, such as food, water, medication, and other essential needs. This is why we should practice social distancing, or by maintaining a distance of not less than 1 meter apart from another. Wear a face mask when going out, or if you are caring for the sick. Should you experience cough or colds, cover your nose and mouth. You may use the inside of your elbow or a tissue, which you should dispose of in a closed bin right after use. Avoid touching your face, particularly your eyes, nose, and mouth, so that the virus will not be able to enter your body. JCI Philippines is one with our frontliners, who tirelessly continue in fighting the spread of the virus and care for those who are affected by it. We are very grateful for their dedication and sacrifice. Let us all practice these preventative measures, because when we protect ourselves, we protect them too.